Administering medications by mouth, oral medications. Objectives. At the completion of this module, the student should be able to 1. Administer medications by mouth, oral. 2. Administer medication under the tongue, sublingual. 3. Administer medications inside the cheek, buccal. 4. Document medication administration on the MAR, Medication Administration Record. Procedure. Perform skill and general medication administration checklist. Always work over a clean surface. Try not to work over the MAR to avoid spills that will make it hard to read the MAR instructions. Do not touch the pills to keep from putting germs back into the pill bottle and or change the consistency of the medication. If the pill falls onto an unclean surface or onto the floor, dispose of the pill per agency policy, such as wash it down the drain or flush it down the toilet. Record that it was properly disposed. Some agencies have a special sheet to document disposal of contaminated medications. An example of a contaminated medication destruction record is located in Appendix C. Documenting the loss of the medication and ordering a replacement medication will help to prevent the client from missing a dose later on. Pour pills from the multiple dose medication bottle into the lid of the bottle, then into the scuffle. Paper medication cup, or plastic cup without touching the pill. This allows you to replace pills into the bottle without touching them if you pour more than what was needed into the cap. Multiple pills can be placed in the same paper medication cup for ease of delivery. You may need to assist the client to take one pill at a time if needed. Do not borrow medications from another client. This practice greatly increases the risk of error. Use appropriate measuring, cutting, or crushing devices as needed for a medication as listed on the MAR. Check the MAR for directions about crushing. If in doubt, do not crush or crack or check with your supervisor. Mix powdered medications as instructed. Dilute them as instructed on the MAR and package. If a medication needs to be diluted prior to giving it, dilute according to package instructions. Liquid medications come in many forms: solutions, suppressions, syrups, and elixirs. Shake liquid medications well before pouring them. Pour liquid medications holding the label under your hand to protect it from spills. Pour each liquid medication into a separate container. Measure liquid medications on a flat, level surface at eye level to make sure you have the correct amount. Use only appropriate devices to measure liquid medications. If a medication comes with a special dropper, use the dropper only when given that medication. Assist the client as needed to an appropriate position with head elevated. This helps the client swallow pills better and helps prevent them from getting choked on medications. Provide the right documentation. And that was the reading of Administering Medication by Mouth, pages 70 and 71 and 72. Thank you.